coming to you live. The baddest radio TV talk show around.
My better, my better, my better, my better, my better, my better. We got everything politics on my better. We got everything media, TV, Twitter. We got everything politics on the scene. My better, my better, my better. Follow my better. Introduce it. Your host and co-host,
Kevin Ceva.
Hey, how y'all doing? It's Monday, May the 4th, 2020, and I'm your host, Kevin.
And I'm your girl, Ceva.
And you're listening to My Better Half Unplugged.
Yes, we are coming to you live from home.
From home. The quarantine been here about 2 months, and we decided we're going to start broadcasting our show from home while we in this pandemic. And you can follow us
on My Better Half live with Kevin and Ceva.
Mm-hmm.
So if you can go to that page, you'll see us live.
And we got a great show tonight. We wanted to do something to educate the community because we are in a time where people are getting false facts, they're getting misinformation. And so we wanted to do a show that's going to help us really in the near future because we don't know how this thing is going to go. So we didn't want to hear a lot of times the experts that's giving us misinformation on TV. So we went to the community and we found somebody who can give it to you straight. And so he has served as the director of the Dallas Health and Human Services for 13 years and also been an employee for 21 years. He's been recognized for his outstanding management in national disasters such as Hurricane Katrina, Hurricane Ike, and also the Ebola response. So we've got our own expert. So let's get rid of the happy talk and let's get down to the facts. So we're going to welcome to our show, Mr.
Zachary Thompson.
Thompson. I'm going so fast, Welcome to our show, man.
I'm glad to be on it. Glad to get the information out. Thank you.
Yes. So today, you guys, since we're going through this pandemic and a lot of information is going around and we really don't know what's true and what's not true. Well, what's factual and not factual. I'll use those words. And I hope that you guys, Olivia and Doretha and Johnny, Eudora, Sherman, and whoever else join us tonight, that you guys learn something from Mr. Thompson because he knows what he's talking about.
And it's also affecting our families.
Yeah.
In our families. So when you know somebody that's close, if you know somebody that's close, then it's an epidemic.
Yeah.
So we've 125 days into this calendar year, and we're still fighting this pandemic, COVID-19. So we wanted to get it straight from the horse's mouth, somebody that has experience in what we're dealing with. So how you doing?
Well, doing fine, and I'm glad to be on your show and really talk about what we're up against in all of the nation, but specifically in the African American community. First of all, there was a lot of myths out there early on stating that Black people couldn't get the COVID virus. And what we see with the coronavirus is that African Americans and Hispanics are dying at an alarming rate. When you look at it in Dallas County, you have over 4,000 cases in Dallas County. And if you look out to the state of Texas and nationally, you will see that these numbers include or impact African American and Hispanics. We've already had 111 deaths in Dallas County. And tragically, we had one young African American female from Lancaster, Texas, who died due to the coronavirus. So the reality is that this virus is a part of our community and a part of the United States. And the reality is that it's going to be that way for at least the next 2 years. Let's put it on the table. There is no vaccine. So therefore, sheltering at home and this particular isolation aspect is a 1918 model that basically says that if you stay at home, you reduce the number of hospitalizations due to a pandemic, or in this case, the coronavirus. But what we've seen is that these cases are now community spread, meaning that when the individuals came from China and they transmitted it to another individual, and now we're seeing community spread, the difficulty that we're seeing is that it's transmitted in our community. We're now asked to wear masks. We're now asked to shelter in our homes, but no one really understands the transmission. And clearly, early on, they told us not to use masks. And now they're telling us to use masks. And so when you see the transmission that could happen through the nose or through the mouth, and in some cases, you have to look at the surfaces that we touch. And so what the experts really say, and you probably missed that because sometimes they use this word, I don't know, but they've said a million words, but then they get to one point and say, well, we don't know. What's the next step? We don't know. Without a vaccine, they don't know. And so sheltering at home is a 1918 model. And I wanted to make sure everyone was at least understanding of where we started at. And then I can go into some other aspects of this.
Okay, Mr. Thompson, what is it? I know you've had experience with the Ebola and the H1N1 when it came. What is the difference between those two? Because it didn't have the panic that this one has.
Well, when we dealt with H1N1, there was some panic, but we had a vaccine. That's the difference. Early on, the panic was they raced to get a vaccine, and we were able to immunize. And we did it when I was the director of Dallas County Health and Human Services. We were able to provide that vaccine. Now, with Ebola, the difference with Ebola is that there was no cure for Ebola. And so you saw individuals Mr. Duncan, that was his name. He came over to the United States, went to a Pacific hospital, was turned away. I don't care how we try to excuse it. He was turned away because number one, he didn't have insurance and he was African American. Came back, it was confirmed that he had Ebola. And from that point, and one of our slides that we showed that Dr. Perkins and myself went to the apartment to serve a isolation notice to the family. And one of the things they said to us in that apartment complex, in that apartment, was that we will come out negative. The two people that came out positive were the two nurses who were in the room with Ms. Duncan. So I want to point out that we can get excited, but we got to deal with some facts. And so in this case, you ask what's the difference? The difference is a novel virus that no one has dealt with. There is no vaccine, and so there is no solution at this time other than to shelter in place. And so us staying at home, and I want to be very clear, no matter how long we shelter at home, when you eventually go back out, the virus is still there. Until a vaccine. Now, I'm not saying everybody's supposed to go out. I'm going to make sure I'm clear. I just want to point out that you heard of the herd immunity where they want everyone to actually get the virus to build up the immunity to it. Most of the time, those with immune compromised systems, elderly, you're going to find it difficult for them to survive through this aspect. That's why you will see people who have heart disease, cancer, chronic lung disease, stroke, diabetes. These are all high risk for this particular virus, the coronavirus. And so when you look at the African American community, you see that we have health disparities. And in our health disparities, we fit these categories. That's why I think it's suspect when you can have a drive-through, where you do drive-through testing, but you don't have walk-up testing or testing in the community where there are high-risk individuals. And so that's a challenge. We have a food desert where people don't have stores to go to. We also have a transportation desert, meaning that people don't have vehicles to get to places they need to go to. For example, that's why you see school districts deliver lunches into our low-income areas, because just having the lunches at the school is not enough. They need to take to the community in order for the children to get the lunches. So let's talk about the medical aspect in terms of testing. Why are there no testing for asymptomatic? the earlier testing that we saw throughout the nation. Now, and I have to be clear because this is a lot of information I'm trying to give in such a short
I
time.
know, short, yeah.
Right. But see, you gotta understand when you're not at the table, people do things and take action, and we sit by and don't even write or call or ask why. If you set up a drive-through clinic, somebody should have said, where's the walk-up clinic? Why are you not in South Dallas? Why are you not in West Dallas? Why are you not in a walk-up clinic in DeSoto where we saw large numbers of confirmed cases, but yet you have a drive-through, and that's been the plan throughout the United States. And so here's the key. They said you have to have a fever. They said you have to be a certain age. They gave all these criteria. Then what did we miss in that? You know what we missed in that process? They said over 50 to 80% of the individuals are going to be asymptomatic.
Yeah, yeah, that is true.
So you understand the rationale in this. Why would you have a drive up only for that category when most of the transmission is going to happen by asymptomatic? Right, meaning they have no symptoms. And so you can have in the pre, meaning that you have acquired the virus, you may not show any symptoms. And then there are people walking around today in the stores, in wherever you're traveling to, who are asymptomatic, who could be super spreaders and spread the specific virus, and they don't even know it because they're not clear on the transmission. They know that that's why they tell you to wash your hands. Well, we should already wash our hands. You should make sure that you're sanitizing areas. For example, when you get in your car, you should be sanitizing your vehicle every time you get in a car. And if you ride with someone, you have to say to them, no disrespect, but I need to sanitize the place that I'm going to sit. Anywhere that
we didn't take it that serious. We didn't take it that serious in the beginning because do you think that we transmitted bad information more than the germ in the first 30 days?
Well, you hit on a good point. We had no information because we wasn't at the table. So therefore, you open the door for misinformation.
Right.
Mm-hmm.
So when you have no one looking like us or Hispanics involved in the decisions, the planning, the execution, then you're going to leave the door open for this whole misinformation that we saw. So now when somebody finally woke up and said, well, you know, African American Hispanics are getting this at alarming rates. Okay, they didn't change the plan. They kept going with their plan because no one in the community, now they called out to the churches, well, we want y'all not to have church. Okay, come on. They should have called and asked the churches, do you have doctors? Do you have nurses in your sanctuary, in your congregation that can come and give some consultation to how we should help prevention and intervention discussions in the African American and Hispanic community? Come on, it's 2020. We got to quit, listen to people calling us to lead in a prayer. No, we got enough intelligent individuals in our congregation who could have been on committees, who could have been in the planning and talked about if you do the drive-through. So let's say somebody's going to say, oh, they had limited testing, because everybody can always quote what somebody else is saying. Okay, let's say you had 500 test kits. Okay, you could have took the first 250 who were high risk, and you could have took the other 250 and went and dealt with asymptomatic. That's what you see in these numbers right now. When you see the numbers 200 each day, 200 plus, you are talking about asymptomatic individuals who are now showing signs, showing symptoms, and now going in and getting tested. So the point is, and this is amazing as in grace. This is what I always say. Why we keep waiting for somebody to tell us something when we can look in our own community? I volunteer in South Dallas every week. I traveled yesterday in the Oak Cliff area and in the South Dallas area. I'm seeing African Americans congregating with no masks on. And I won't call the specific areas, but they're in. It's like it looked like Sunday dinner on the church ground. Everybody out there with no mask, having a good time.
Right. You know what? And that is so true because yesterday I got out and my daughter and I, we went riding And it's not just in South Dallas. We went over in Rockville, and
Mhm.
we went over in Faith, Texas. We was riding out that way. And you would have thought that somebody opened the floodgates for everybody to come out. And none of them, I can bet you 97% of those people did not have on masks. And
Correct.
you could have saw us trying to get away. And we even stopped at a store, and I mean, zero had on a mask. We were the only two that had on a mask going in that store.
You know,
And
there's a thing about, I was looking at probably four things that they said about, this pandemic that affects African American community. Now, one thing is information. Just kind of give an analogy. If you'll never see anybody take rat poison because it's immediate.
correct.
We flirt with things that have a slow progression of death.
Hmm.
And that's what society does. You can have a warning label on something, but if it's not going to kill me immediately, then I'll flirt with it. Because I think at the end, if it comes down to it, then I can, I'll get healed, or somebody will take care of me. But this here, they're not putting enough stress on this because how it dominoes through the community and through your families. They're not looking at, we see death. When we see death, if it's not on our doorstep.
Right.
When 9/11 hit on Tuesday,
Right.
I was at work Tuesday morning, 8:30, and they said, "Hey, this plane hit the Twin Towers." Okay, that night at 7 o'clock, I went bowling because it wasn't on my doorstep.
Right.
And unless we start putting things on the doorstep of our community and tell it, for what it is, we're gonna always flirt with death.
Well, this is why your show is so important because, and I go back to the earlier process. Look at the message that was going out. The message wasn't targeted to African Americans or Hispanic.
Right.
It gave a broad brush. And so it didn't personalize it. You make a good point for what I stated earlier. If you have no one at the table that looks like us, who are committed to going out in the community, like right now, while we're dealing with the coronavirus right now, we also have to start planning for the next 2 years. We got to do serious education. We got to do education with our seniors. We have to go out in our communities. There should be prevention funding for workers to go into all areas that are low income, that are minority communities doing education. So that deals with the misinformation. But again, when you got a broad brush, so I'm going back, I want to stay in task with your point. You come out one day and you say, we're going to shut everything down. Well, no one really gave a full explanation for why they were shutting everything down. They said a virus, and the virus is deadly. Okay, you're right. We don't see it as deadly because it wasn't explained. Here, if you go on the timeline from January
Right.
to March, I want to make sure I'm clear because I want to stay on your point about disinformation. So we could criticize the president all we want, but there was a lot of people that knew about this virus in January. Why did it wait till March to say shut it down? We should have been talking about shutting it down or the potential for shutting it down in January because there was no cure in January. What makes you think it was going to be anything different in March?
Exactly.
That if I'm sitting in a room, going back to your point about the rat poison, and they say, okay, we got this rat poison, and we're in a meeting in January, and we're going to start distributing this rat poison out. Okay, they're going to say, Zach, where you going? I said, I'm finna leave out here because I'm finna notify my community you finna put rat poison out.
Yeah.
Okay, so you see the difference? When no one is in the room, but they planning, in January, they knew it was no vaccine. In January, they knew it was going to be a transmission. In January, they knew the only model they had was a 1918 model, which is the isolated home. But I always say, whatever program I'm on, in 1918 versus 2020, how many people could have been in Dallas, Texas, or Dallas County in 1918? It wasn't hard to isolate. Now, when you start talking about 2.4 million people,
Right.
right, plus, if you go into Harris County, that's probably 4 million. And so I'm going to tell you the game that everyone played. As soon as they say, well, okay, we're going to shut everything down, but we want essential workers only, where everybody became essential.
Exactly.
Right.
Exactly.
And see, I'm from Houston.
Yeah.
I'm from Houston, and there's a tale of two cities. So I called down and asked my brother, "What are you doing?" One brother said, "I'm on the golf course." I said, "They shut them down in Dallas. He's where they have it shut it down here,
Mhm.
and that's only 4 hours away."
Right.
So that's what I mean. The misinformation. The month to month. Different myths and changing. Of information, and then playing the blame game has us. In different areas, because I've been in this house for 2 months, and they're just now shutting something down in another city.
Wow.
That's
So
right.
it's not across the board. And so that's why if I talk to somebody else, my color,
Mm-hmm.
and I'm talking to him in Alabama, and
Right.
he has a different view because they're not doing anything. His
Right.
state government is not doing what my state government is doing.
Correct.
Then I'm going to look at, okay, somebody's lying.
Well, but you got to understand, we're dealing now. That's why I mentioned about the 20 versus 1918. You try to shut down 2.4 million people, and they're going to tell you, do you believe in the Constitution? And what they mean by that is, I can do whatever I want to do. And so that's the mindset that you have to, but that's why I'm saying you have to start in January. You can't start in March and say, oh, okay, tonight, effective at midnight, we're going to shut everything down and you can't move. Well, you should have been talking about that in January, then get the message. So when you say that how everybody could get on the same page, well, we have to ask our African American politicians who are statewide, to make sure this message gets out. I don't expect the folks that we're seeing on TV or on a national level to tell us anything. The question is, everyone who was involved in that conversation in January knew that we were going to be at this point, and I'm trying to figure out why that wasn't broached in a conversation and planning that could have been spread out to the community. So it deals with the information, education. Churches could have been involved. Schools, look where we are right now. Schools may not even be able to open in the fall, and so we have challenges. And so we're going to have shutdowns again. So why do we have a run on toilet paper and paper towels and you couldn't find nothing in the store? That's because you can't wake up one day and say, I'm going to shut everything down and you got to stay at home. People became fearful.
Right.
So, and another thing, you were saying something about the education part. Okay, so we know that COVID-19 going to continue to impact this nation, right? Into
Correct.
the future. So who you think going to provide this ongoing prevention and knowledge to our community?
I'm looking at y'all too. Y'all, we're going to start with y'all because basically I'm going to put it on y'all shoulder because nobody else is doing it.
Well, that's one of the reasons. That's one of the reasons we did it. But it's something else I want to run by you because I know our time is just going so fast. I was talking to someone else on a call one day, and I was looking at. They were talking about clusters, okay? Mm-hmm. And I told them, I said, me and my wife, we worked for HUD for a while, and so we were going to the apartments in South Dallas, and I was
and Pleasant Grove.
How these people lived in these houses. And some of them were grandfathered in the asbestos area.
Right.
So, see, my house, I have a fence around my house.
Correct.
Okay. The apartments where people live, and there's 100 units, they're fenced in. So they all touch rails.
Correct.
They all touch the same keypad. They all touch the same dryer and washer if they have a washroom. They all play at the little PlayStation in the community. They all go to the pool.
Correct.
And there is no housekeeping there that sanitizes things. An apartment complex is the most unsanitized area that you'll ever live in.
Right. Well, and one of the things you saw with that quarantine particular slide that was up, that's a key point, because when you talk about having a plan, this is part of the plan in January. You're exactly right. In March, we're talking about how you're going to do things, how you're going to sanitize areas. That should have been a discussion in January. We have housing developments. We have congregate living. These are the plans. So when we isolate, we basically have to look at this. Now, when you talk about quarantine, that takes on a different perspective. If I go and get tested and I'm confirmed to have the coronavirus, then they want to quarantine me at home for 14 days. I can't go anywhere. They want to bring me food. They want to do these things to make sure I'm not interacting. And so the point is, when you start talking about sanitizing communities that we live in, you're right. No one was going out spreading that message. But I'm going back to January. They knew that we were going to be at this point. And you hit on one other point, and I don't want to leave out. Why do I have to go to North Dallas to find bleach? Why do I have to go to North Dallas to find Lysol? When you're in the southern sector, it's very limited. And I see senior citizens early in the morning when they go to the senior hour looking for these items and they can't find them. And I drive right over there, for 75, and I go right over into the North Dallas area and I find Lysol, I find the wipes, I find the bleach, I find toilet paper, and I call one store I go in a no limit store because they don't even have no limit. When you're in the South, they tell you to get one. So and so we got to look at the disparity. Is that the key point is that from the health standpoint, there's a disparity, and you're right. That's why everyone that's out here spreading this information is going to be key to getting this information out in the community.
Yeah.
Right. And the other thing is, I was watching TV and they were talking about some of the states, because the states were battling. States were battling, trying to buy protective, personal protective, wear for the house pillar. And they were going to other countries. They were going to other countries trying. So they had one of the governors had went and bought some masks, from South Korea, I think, and had it shipped in. Had to secretly ship it in because the government would come and seize it. Don't think that Lysol was good as gold. And I work in a nursing home, and I'm gonna tell you how hard it was getting. It was how hard it was to get Lysol. That stuff was on back order.
That's right. Well, but I want to point out. But they knew this in January when they started talking about it. And one of my slides, I talk about that in 1999 they began pandemic planning. N95 masks, having ability to clean areas. You brought up nursing homes in January. This whole response plan. This is why I want to make sure it's clear. In 1999, they talked about pandemic planning. They've been planning for a long time. But that's when they put, and you brought up a good point, right after 9/11, that's when they brought public health, law enforcement, and everybody together and started to talk about pandemic planning. And so this is not new. And so when I see people say, well, we're running out of masks. Okay, you know what? That was part of the plan to have masks. We don't, remember in Ebola when they said that the nurses didn't have on the proper personal protection equipment? Okay, that was in 2014. Okay, now we're still talking about in 2020, what they saying every night on TV. We don't have yeah. So my point is, come on. Y'all have to get the message out. You see the graph that's up there from 1999 to 2020. We've gone through Katrina, Ike. We've gone through major where people had to move from New Orleans, and we sheltered them here in Dallas and Houston. We've done a lot in terms of planning. And so now we went to H1N1, then we went to Ebola. Now we met what they call the invisible enemy because we have no vaccine. So, and then you'll see them early on. Well, we'll have a vaccine in 6 months. Then next thing you know, we'll have a vaccine within the end of the year. It's not going to happen. They're selling us, and I'm just not going to let them just misuse us by keep telling us there's going to be a vaccine. Wear the mask to protect you and your loved ones. If you're going to another person's house, such as a senior citizen, wear a mask, protect them, because you might have been around someone who is asymptomatic, and we don't want to pass this on to our seniors. But you raise a good point. Nursing homes, how come they didn't reach out to these nursing homes early enough? And most of the deaths that we're seeing are in the nursing homes.
Yeah, that is true.
I'm from Houston, so I've experienced. I was there when Hurricane Ike. And I saw the preparation because they got through that one pretty quick.
Mm-hmm.
You know, they learned from Katrina, and so when Ike came, we recovered pretty quick.
Right.
You know, so the thing is, we get ready to go into a hurricane season.
Correct.
Okay, can you imagine Hurricane Harvey with this pandemic going on?
That's right.
Because those folks, you know what happens to 288,
right.
You know, and I-10, and them people come out of there and they had to almost get boats to come out of there, and they all had to congregate at a shelter.
Correct.
Because they can't go to the house.
Right. Yeah. And you know what happened in them shelters? If it wasn't sanitized, you ran the risk of transmission of virus. Because and when we dealt with Katrina, most of it, well, this is what I found amazing. They put everybody on the bus and brought them from New Orleans. They checked them for guns and other things, but they didn't offer to give them a bath when they got here. They still had the same water on that they were trapped in New Orleans. That's how they treat them.
And so they tore that Astrodome up.
Right. So you raise a good point. But okay, here's the question. Have we written a letter to say, how come there's no African Americans in the planning in this pandemic? Why don't we have certain things in our area? We sit back, and that gives into the misinformation, and we got to take it serious because we're the ones dying. When you add up the Black and Hispanic deaths, we are the largest number of deaths from the coronavirus. So that's the issue that we're faced with.
And who do you think gonna pay for that, to put those African American people in there to do the health prevention? Who do you think gonna pay for that? Who do you think should pay for that? Gonna be funding that.
Yeah, so, I always talk about when there's trouble or there's a national calamity. It's like when they put the money out, it's like we only get a slab of ribs. Because when you start going into trillions of dollars and then it's given out and you broke, and then you gotta launch another bill. I know it didn't come this way.
Correct.
They're not even thinking that deep.
Right.
They're not even thinking of mom and pop. They're not thinking about that. And so when you have this disproportion of African Americans dying, there's only 14% in the city of Detroit, but it's 48% of the death rate in this pandemic.
Okay. Yeah. And that's we're not making an inroad. And your point is clear. When you look at urban cities throughout the United States, you see HIV rates are high, TB cases. You see all of the ills, heart disease, kidney issues. These are all in urban cities. And so now we have the COVID-19 that's showing that we still got challenges. So you're right. So where's the money coming from? Well, I want to point out to everyone, it looks like they've been printing up a lot of money to me. They still printing. And so and I've said this over and over. I've been in Dallas all my life. Today, we got more African-American politicians than we've ever had in our lifetime. And so getting money should not be a problem. And so, but the amazing thing is, Grace, is that you got other folks who sit up there that don't want to make sure we get the money. And I challenge us to make sure that money comes into the African-American community to do, number one, we got to have prevention. We got to have people who look like us, who are from the community, who are not afraid to go in the evenings, on weekends, and do education. And that's not only to communities, but to nursing homes, high-risk facilities, because it's not happening. And if we don't ask for it now, it won't happen. We have the worst economy that any of us have ever seen. All of us together have never seen this economy in this type of situation. Everybody sit back, I'm gonna sit at home. But let me ask this question. You can sit at home if you're still drawing a check. But if you're not drawing a check, you gotta try to get out here and go to work and put a mask on. So they pitting us between each other. Let me say this about the elephant and the donkey. I'm not gonna let them run over me, both of them. And that's what you got. Right. They running over us with the partisan politics. And we have yet to wake up and listen to, on one side, go to work. On the other side, no, don't do anything. We're going to wait till the scientists tell us to go. Okay, at the end of the day, they walking out. It's called a Harlem Globetrotter theory. You let the Harlem Globetrotters do the show, and then you let this rich white person walk out with the money. So I'm not gonna be the Harlem Globetrotters. We gotta ask
You
for
know,
those services in our community. We're astute enough. We're intelligent. We have the numbers. You can't get elected in this county without our votes.
right. The other thing is the analogy, just like you said. I want to make one. You made the elephant and the donkey. I want to make one about a storm. Whenever it's like Hurricane Harvey, when it flooded, okay, people were waiting for it to stop raining. But when it stops raining, it's still wet outside. They're not gonna. We're not gonna appreciate the damage that's been done through this pandemic. They're looking for. We want a vaccine. We want a cure. But when you get the cure and this pandemic say it goes away, you won't appreciate the damage that it's done. Because now what you have Big Mama passed away. She, her Social Security check was the only thing paying rent here.
Yeah.
Good my dad's not here anymore. He's the one who took me to school. Yeah. I done missed school, so I don't even know if I'm graduating. Now I'm socially and educationally behind it. We're not going to appreciate the damage that this has done in the community. All we worry about is getting back to football. That's what I'm saying. Our minds are not there because we were already at the edge of the ledge anyway. But they're not going to appreciate the damage that we talking about a recovery that's going to take us probably 5-6 years.
And that's why we need to have a plan where we're all sitting down at the table. Dr. Davis, yourselves, everyone who's in the social media, we need to sit down and look at a strategy for how we go forward, how we're going to approach from the standpoint of putting in credible planning and execution on prevention and education in our community. That's the first step. But until we broach the conversation, they won't. They're telling you there's not enough testing available. And we're the main ones getting the virus. So we don't challenge anything. They put a testing site in Pleasant Grove. I think they're putting another one in Garland. Well, when they're going to put one in South Dallas? When they're going to put one in high-risk areas? But again, since we're not at the table, we got to wait on them. You see on this link, I list out the Texas Department of State Health Services. You also can see coronavirus, CDC. You can check any of the stats that we talked about tonight. They're there. That's what you should do every night. Cut the TV off. Let me say this, because one point in I talk about depression. Now, let me say this. Right. If you sit there and you look at this every day, first thing sets in your mind is it depresses you. But you know why you get depressed? Because you're not doing nothing.
You're not doing nothing.
The only time you get depressed is when you can't do anything. So what you should do is go visit a senior, go check on people, but cut that TV off. They're not trying to tell you anything you can use. They're depressing you, and you let them depress you, and then you can't sleep.
Right. So wait a minute, wait. You say go get out and go visit people doing
you can go into the neighborhood and drop off things at the door.
Right.
You can go and blow the horn and there are things you can do without actually physically going in. I'm glad to clarify that. But call them on the phone. Those are things that you can do. But if you drove by and they say, call them, stand at the door, I'm going to blow the horn, wave. And it's ways to do that. But you got to manage the stress. But stress and anxiety, people are saying, oh, I can't stay in my house. Well, let me say this. I thought that's what you bought a house for, to have somewhere to stay. Now you don't want to stay in there. But let's say this. That's fine. Everybody want to get out. But the thing is I want to get out alive. And so you got to manage stress. You got to manage it with your children, with your parents, with your loved ones, to make sure that they understand is that this is a long-term battle that's not going to be overnight. That's where the stress come in, because we used to something happening for, as you pointed out, something happened for a couple of days and then we back to normal. No, we have to deal with this for a year or two.
But this contact tracing that they get ready to start.
Right.
I'm watching a protest in Detroit where all these people came into the 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 um the federal building, and nobody has masks on.
Correct.
How in the world would you enforce that when they dismiss and they come in contact with somebody? How are you going to enforce that? That's the thing. Because people, if they're not in compliance, you're not going to enforce anything.
Well, but let's say me and you would have went up there with AR-15, we wouldn't even got in the door. Let's start being here. Yeah. Matter of fact, they'd be having our services now. But I want to point out, you talked about contact tracing, and that's a key point. Let me point out why this whole testing is not a reality. Because for every test that's done, you have to do the contact tracing. Can you imagine them doing 1.3 million or 2.3 million people testing them? That means that's the contact tracing. Because if they come back positive, you're going to have to follow up on those individuals. That's a good point. A lot of people hearing contact tracing. For every TB confirmed case, you have to go and do contact tracing. For HIV, if a person says, if they come in and they HIV positive, the first thing they ask them, you have, please identify those individuals that you have slept with, whether it's 3 or 20. That's contact tracing. So when you start talking about this virus, we're talking about the same thing. Contact tracing. That's too expensive. But guess what? There may be some new jobs for African American and Hispanic, because contact.
It's going to be new jobs. It's going to be new jobs. But the thing that's different between that, and trying to trace somebody with HIV, you telling somebody that finally got out of their house and got a job that they got to go back and quarantine.
Right, that's true.
They're not going to comply.
No, they're not.
They're not going to comply, and that's the thing. So, what are you going to come in, martial law now?
Well, that's what quarantine is now. If you don't follow the guidelines, the court can put a court order on you and quarantine you. And you don't want to go that step. So that's why they ask you to voluntarily isolate yourself. But the next step is, if they say, Zach, you've been confirmed, they can write an order to say you can't leave for the next 2 weeks. And so those are the kind of things we don't want to get to. But the contact tracing is a key point. There's not enough person power to follow up on all the individuals that can be confirmed. Let's look at where we are. We're seeing that, number one, the largest number of cases in Dallas County are Black and Hispanic, and throughout the nation, Detroit, Houston. When you look at the number of deaths, when you combine African American and Hispanics, we're leading in that area. So my point is, as you pointed out, it's almost like when I think it was Ray Nagin, the mayor of New Orleans, when he had to do that last second shout to everybody, get the hell out of here, because they didn't want to leave. That's the same message. But guess what? The messengers have not been talking to our community. They've been talking to other communities, and we didn't listen, because there's nobody that looks like us.
Mm-hmm.
How do you think they're going to handle the kids going back to school? Because that would be a concern of mine, since I do work with youth through my organization. And so I know I'm not going to do no summer camp, because I just can't take that chance. But how do you think they're going to handle opening the schools back up with these kids, especially if they're talking about opening it back up in September or either August sometime? How do you think they're going to get that information to those kids? And
well, I'll tell you what, two things. They're definitely going to have to do remote learning, continue that. That's another story, because most connectivity is lacking in African American community. And then they're going to talk about spacing. So it's going to be school different than we've ever seen. If they try to come back in, so here's the point: if they try to open up in September, this is something your listeners should do. First of all, they should ask in their school district how many confirmed cases of COVID-19 in school-age kids have been reported. That should be information that all of us should know. I ain't seen that written anywhere. And so that should be the first thing. And so when you have the data, so then the next process is how are you going to protect our kids in terms of the virus, because it's basically an invisible enemy. Yeah. You've seen school personnel, you've seen security guards, you've seen everyone else with COVID-19. So now they're going to have to come up with a different way. Here's the thing. I want to make sure I don't lose this thought. They keep telling you about 6 feet, but we know it spreads further than that.
Yeah.
So when you talk about a classroom, are they going to be able to open up in September? Let me say this: they're they're praying. You would think that they are going to a Baptist church. They're praying so hard for a vaccine. You just don't believe how much they're praying because they know that's the only thing that's going to stop this. Without a vaccine, they're going to be challenged to open up in September.
Okay, we're going to take a short break, a minute break, so don't go anywhere, and we're going to come back. So
we can re-identify you. So people know.
Ooh, ice cold. Freeze pop.
Hi, you guys, and we're back, and so happy to have all you guys watching us. Dee Dee, William, Felicia, Kiki, and Simon. Thank you guys for joining us back on our very first day since the quarantine because we've been out and we've been missing you guys, and we sure want to thank you for taking your time out and joining us. And I hope you're getting some valuable information from Mr. Zachary Thompson, who is the former director of HAS,
Dallas County
Health and Human Services. Yes, and I really appreciate him sharing his time with us to educate you guys on the COVID-19 because there's a lot of different false information out there saying that we can't get it and things like that. But he's here to set the record straight. And so we're gonna get back to, if you guys have any questions for him, you can, text me and I can ask him for you. And we can answer it in live time. So
they're talking about a second wave, and they said if we have a second wave, it's going to be worse than the first. But I think we should be a little bit more prepared. Maybe not in equipment, but at least we know what happened in the first quarter. But if it comes back in the second wave, will it ride the coat of a regular flu or allergy? Will we be able to tell the difference?
I tell you what, if you see a second wave, it's probably going to be definitely deadly because you'll be dealing with the flu. And when you start talking about planning, most of African Americans, as I've seen in the past, were not taking the flu vaccine because we have an issue with taking vaccine. That's another issue. Even if
That's another myth, right?
Right. Even if we came out with the coronavirus vaccine, would we
I've heard
take?
A lot of them saying they're not gonna take it.
Okay. Well, see, and then here's the other thing. We're still operating on Miss Everett Boy's concept. We're thinking that this is the Tuskegee Project, but let me point out, clinical trials really help us in terms of being able to deal with any medicine that we're taking. I'll give you an example. African Americans, if you look at the data, heart disease, we're predominant in heart disease in terms of number of cases. Well, we have challenges with the medicine they give us because number one, the medicine is a challenge because during the clinical trials, they tried the medicine on white males or white people. And so they don't have the luxury of having how this medicine may react. So my point is that the second wave is going to be deadly. We need to prepare now. That don't mean buying up all the toilet paper. It's not that much diarrhea going on. The key is that what we need to do now is to prepare for a second wave by making sure we have masks, making sure we're sanitizing our areas, talking with our places of work, and when that second wave comes, because the virus will still be circulating. What's okay? It's not if, but when. What's going to stop us from having a second wave when you don't have a vaccine? This is a novel virus, and here's the thing: they'll quote Doctor this and I'll give this example. I got a mechanic. He may fix my car, and I asked the question. He said, "Well, I'm the mechanic." Well, I'm gonna still ask the question because I'm the one driving the car. The point is, because they're a scientist, there has to be a second opinion. There has to be a question. So the question is, we're isolating at home, but the virus is still circulating. You're trying to prevent the hospitals from filling up. But let me tell you what's filling up. They're filling up at the funeral homes because they're not even making it to the hospital. Some people were dying in their own apartments.
Right.
And we saw something today where the people are making it to the hospital, but they dying in the hallway on their gurney.
Yeah.
So,
and see, the other thing is because I sell insurance, okay, and they have amendments and different clauses in insurance policy. Say, for instance, I go outside. I got an accidental death policy. I go outside and I go around the block, and a car hits me, and they have to come and lifeline me to the hospital. But I stay in the hospital 3 days, and I die of heart complications. They're not gonna say I died in a wreck.
Right.
They're not gonna say I died by accident. They're gonna say I died by, heart complications. So a lot of these people are going in under COVID-19, but then they get in there and they die of heart complications. So they don't even get classified in the death toll. They're gonna take that down. Because sometimes insurance companies don't want to pay that.
Oh yeah, you raise good points, and that's what our community. So first of all, we never had a community conversation. Dr. Esther Davis, this is the first time people have really sat down and started having community conversations. No one had. That's why I keep going back to January, but January is gone, and March. But at that point, now we have to have a serious community conversation with the stakeholders for how we move forward to prevent or reduce the number of deaths among everyone, but especially among African American and Hispanic, and with this second wave. And so when is that going to happen? We don't challenge anyone to really talk about what is the planning. And so we have to spend time to talk about I'm talking about concrete planning that's going to deal with education, and I'm talking about funding. I ain't talking about doing things for free. Everybody else getting care of money. How come everyone who's doing social media right now, like your program, is not getting care of money? I'm saying everybody may not be out for money, but I'm telling you, they're giving out money like it's flying off the wall. So my point is, if you're gonna give it to the airlines, ain't nobody riding them. Give it to social media for African Americans.
This is a service to save lives. That's really one of the reasons why we did it.
Yeah.
Because we figure the education goes out there. Because I'm getting my hair cut, and some of the worst information is in the barbershop. You got guys, man, they don't even know what they're talking about. But somebody's cutting your child's hair and feeding him this propaganda. And then he leaves out, he repeats the same thing, and then we start transmitting bad information. And if you just talk to people, you said 10 guys in a room. I don't care if they're African American. You said you're going to get 10 views of what's going on, and 5 of them are going to be wrong.
Well, you know what? You bring up a good point about the barber and the beauty shops. One of the things that we could do is basically the best program I saw early on was a high blood pressure program where they had a community person in there taking the blood pressure of the people while they're getting a haircut. Right. And I'm gonna tell you this: they saved a lot of people's lives because a lot of people wasn't going to the doctor, but when they were in there, their barber said, "Hey, yeah, get your blood pressure taken."
Right, and that's where a lot of the information comes. If it's not in church, because that's where we gather for a time, and you got to sit at least 15 minutes.
That's right. Right.
And so I went and talked to some of the barbers about that, and before this came up, I had a program that I was going to try to help launch with that. But what I'm saying is that it's the misinformation. And we've all had it. I mean, I spread bad information before I really sat down and I talked to another level of people.
Right.
And then I knew my facts were wrong.
Right. Right.
And I surrendered and I said, you know what, I was wrong. Because this guy, he's an expert. And see people like you in our community, we don't necessarily seek you out because we sometimes don't even know you exist.
Mm-hmm. Mm-hmm. Well, and see, you raise a good point. The point is that now that we know, then we need to, that's the planning going in the future. Let's use the coronavirus now to have an African American that looks at health, that looks at economics. Right now, we're challenged between both the health and economic, and we're not getting a direction on either one of them. And that's why I'm saying the donkey and the elephant is running over us. And then when everything is over, everybody will walk out with their money, with their health, and we're the ones still struggling.
Yeah, yeah.
And see, another thing is after this, that they haven't really taken consideration, they're going to have to pass laws that these businesses are not going to be liable for spreading, because they're not going to comply and have this social distancing. And the other thing is that because we, I always talk about America. When you have capitalism and you don't have a conscience,
right,
you'll sell your mama. And so right now, these meat packing companies, they already got COVID in it. I hope this thing doesn't transmit into food.
Right, that hasn't been proven yet. But the point is that you got workers who are dying, and they could be our relatives, our brothers and sisters who basically are dying trying to go to work. So at the end of the day, but you got to remember, we don't have a committed public health strategy that deals with African American and Hispanics who are working in these low-end jobs to try to help them understand how important you at the end of the day, your health is your wealth. You could be a millionaire, but if I'm laying in Parkland Hospital with $1 million, then that doesn't mean anything because my health is bad. So what's worth $1 million is my health. And that's why your health is your wealth. And that's why we're dying at alarming rates with diabetes. And that's why the COVID-19 virus is hitting us. And so when you look at what we're impacted with, we got to talk about exercise. We got to talk about healthy eating. But I'm not going to badger people to change overnight. It got to be a teachable moment. And you talk about food deserts in South Dallas. You look at the stores that we have. You got food pantries supporting these places. So I commend y'all for what you're doing to get the information out. I have to say that the people even the people that's giving out misinformation, here's our opportunity to now plan to get them the information they need so they will be able to assist our community.
Yeah, because you can do what everybody else is doing as African American. You can create employment in a pandemic.
That's right.
All you have to do is sit down and network together, because that's what people are doing. My daughter-in-law just took a piece of cloth and made a mask and came in here and said, "Look," I said, "You know what? I mean, my daughter, she just made a mask, and she made it." And I'm looking like, "Where'd you buy that?" She's not made this, and that's what we were resilient like that at one time.
Yeah. So we got to be that way now. Yeah. Well, where's the black? Where's our black chamber and all the people talking about businesses and develop during this time? We've taken a back seat on, I don't have a problem with no race looking out for themselves. I got a problem with the fact we're not looking out for ourselves. So I can't be upset with nobody. They keep doing what you're doing. But the problem is we're the one dying based on lack of information, and we have the commitment, but we don't have folks going back into our churches, into our barber and beauty salons, and we got to spread that information. And how much money has been spent on the African American media to get the message out? Those are kind of ways. We got to look at all avenues. Prevention workers who live in that community could be trained to be ombudsmen, to talk about how to support and protect yourself during a pandemic.
Well, that's why we're gonna continue with this information because of it being so valuable for us that we're gonna go to some of the frontliners and bring them on next because we do need to be educated.
Yeah.
Right.
And we're not getting the information we need because there is no African American TV news broadcast anymore since TV One has left and Roland Martin is no longer there, but he's on podcast. So you can find him there. So if this is our new way of communicating with people, then that's where we will be.
And we need to target our backyard.
Correct.
That's another thing, I mean, these other ones, they are syndicated, everywhere. They're not really targeting a specific area. They just talk about, black people in general. And I'm talking about if I'm driving down the street down here to Fair Park.
Correct.
Because there won't be the fair this year.
Mm-hmm.
I hope they don't do that.
You think
it's gonna be a challenge. Yeah, it's gonna be a challenge. If they don't have a vaccine,
that'll be our Mardi Gras.
Yeah, they won't bring that many. They can't bring that many people together without a vaccine. Yeah.
But when I say money, if there's not no information, they'll let them in with masks.
Yeah.
Because they got to make that money. But then, what is going to cost?
They can't get $20 with that mask.
Yeah. I was just saying, it's the corner dog of your life. So what I'm saying is, that's why we're targeting, responsible in our area. Our broadcast goes national. Yeah. But we want to target this area because our nonprofit is in this area, and we try to educate these kids because some of them already 2 grades behind in reading. And you're talking about a suspended school year and one that might not happen.
Right.
That child gonna give up.
And that remote learning, when you have to, you know how much school districts are paying for hotspots, and in the 21st century, can you imagine not having internet connectivity in your neighborhood? You basically have reduced them to a slave perspective because you're not giving them the information highway. That's ridiculous.
So I don't take what they can't do. If you put up a portable hospital in 4 days in New York, don't tell me you can't put up a hospital in South Dallas.
Right. Or testing. We didn't have testing. If they just did testing, we at least would have known today. When you go to this website, these links, they give the number of tests that have been done. And so and so when you go to the Texas Department of State Health Services, that first link you can click on, they'll tell you how many tests have been done in the state, and they break it down by counties. Just in Dallas County alone, there's only been 30,000 tests done, maybe a little more than that. Okay, how many people are in Dallas County?
Per capita. Yeah. They keep showing these numbers, talking about how many you're doing per capita. What is that?
It's nothing. It's nothing. 30,000 people tested is nothing compared to the number of people in that. Matter of fact, the state of Texas is next to last in testing in all 50 states.
Right. We're behind.
Yeah. So we don't demand.
I don't even know if we reached our apex. I don't know because we're going through the summer. But what I'm saying is, you're going through a hurricane season.
Right.
All you need is 2.
Right. Hurricane.
All you need is 2 with no vaccine.
Yeah.
And you can have a problem.
And flu. We'll be talking about flu. I'm sure. What is this? May, June. They'll be coming out with the new flu vaccine real soon. It might be already out, but because
yeah, I think it's already out.
So so you know what African Americans gonna say? Well, I ain't gonna take that flu vaccine because it give me the flu. Well, I'll tell you one thing: over 30,000 people die every year nationally from the flu.
Right.
Well, you know what, Mr. Thompson, I was one of those people who say that.
You know what?
Because the last time I took it, I developed pneumonia. I was like, that's it for me. I will not take it anymore.
You raise a good point.
You raise
a good point because what we found, and sometimes it was only 40% effective. And so a lot of times that turned people off. that it's not even 100% effective.
Yeah.
But them, you know, erasing the the regulations and trying to fast track these vaccines, not knowing any kind of side effect, not knowing whether they're actually, you know, working, is going to give a false narrative also.
Well, that's why they're moving to treatment. Now you hear them talking about we can cut down with certain treatments from 20 days to 15 days or 15 to 10 days because they know the vaccine to prevent it is a long way off. I'm telling you, I already know. You probably think that they grew up in a Baptist church. They praying harder than we are to come up with a vaccine. They know without a vaccine, it's going to be on.
Yeah, this economy is going to be jacked up.
It's devastated. You never seen
it jacked up.
Like this.
But you know what? You're gonna, you know, even in that, you know, you have to create an economy in the collapse of an economy.
Correct.
Yeah.
Because there's still going to be a need.
Well, but
it don't matter if they shut down every restaurant. Yeah. You're still going to have to feed people.
Well, this is what I hope, that through all this, that we don't let our health deteriorate and we don't let our mind deteriorate and deal with this whole mental issues behind all of this, because we got to come out stronger. You got to rest through this. Let the good Lord take us through it. Relax your mind and come out strong. You're right. For every day that we're sitting in isolation, we should be creating something new. And so if that's why I say cut the TV off and get creative. Don't look at this situation. Let's get through it. Protect yourself, protect your mind, protect your family. And then when we come through this, we come out stronger. At the end, we went through 400 years of slavery. If they were concerned about us, they left us in Africa. We came through a slave ship. And they went on this whole premise: the survival of the fittest will make it through the transporting of Africans to America. In this particular virus, that's the same mindset: the survival of the fittest, who will make it.
That's a good point. I like that, how you put that at the end. That was really good. And with that being said, too, with this virus going around, I just released my book that I just finished, and it's called "Is There Order in the House?" It's an estate planning book. And in that book, you know, a lot of times we as I won't say the word, but we as a people, we don't like to think about estate planning because we thinking that's for I'm about to die or you know something get ready to happen, but they don't realize it's for the living. And what you're doing is preparing yourself for in case something happened and you are the breadwinner of your family, then how are they going to be provided for if my income is taken away in some form or fashion? So if they have somewhere where they can like notarize their book and have all the information in one place, they can just take this book and write everything down they need, like the arrangements or who's going to do this, if they have life insurance, if they have rental property or they have a business with someone else and they need to sever that business. I mean, this book has everything in it. So if anybody's interested in getting my book, email me at Carol, CAROLB, as in boy, at tomorrowspurpose.org.
And one thing, just kind of piggyback on what she was saying, because we do that kind of business. I remember talking to one gentleman, one lady, and she was talking about her father had passed away 2 years ago.
Wow.
And so she was depressed. She was depressed because he was the provider, and death is going to happen. So I told her, I said, well, where did he work? She said he worked at some steel company somewhere. I said, did you check to see if he had insurance on his job?
Wow.
She said no. And she went back. I said, Google him. And she went back and found out he had $100,000 insurance, but it was just sitting there. I said, are you have a power of attorney with him? Yeah, I do. I said, then you can go and claim that.
That's right.
Because there's a lot of stuff that we leave on the table when you talk about no information and misinformation.
Correct.
And that's what I'm saying. These guys that be talking don't know what they're talking about. It's all kind of money. You just go online. They got that list of money that's just sitting there in insurance companies because somebody died. They're burying these people out in New York in the Potter's Field.
Yeah.
Nobody claimed them.
Yeah.
Wow. Wow.
And they're not going to call you. They're not going to call it next to kin. And if you don't have that information, you're going to leave that money on the table.
That's right. That's right. Excellent.
But with you being here, we sure appreciate you. And if there's anything else you need for our listeners to know before we get ready to leave,
y'all God sent, and I hope y'all continue to get the message out. And any way I can be of help, let me know. I'm still on the ground doing things in the community, so y'all keep doing what you're doing, and let's keep our community strong. And remember, your health is your wealth.
Yes, sir. Thank you so much for that. We appreciate you. And like I said, I hope you guys, Cheryl, Patrick, Wendell, Sharon, Simon, Kiki, thank you, Dee Dee, thank you guys, William, Riley, all of you guys, Felicia, for joining us. I know I didn't go on the right page to send it out, but don't worry, it's going to get better. Because it's our new show, trying it from home, but we're going to have another show. So this is going to be our new normal for a little while anyway. And I'm sure it's a lot of you guys' new normal as well. So just keep your head up because things going to get better, trust me. But don't forget, hit me up if you want that book.
Yeah. It can't get better. It can't get better without information.
And we're trying to bring you guys information.
Yeah, you have to have the information. So, through this pandemic, through the summertime, stay safe. If there's a new wave, we need to make preparations.
Yeah.
That's right.
Any kind of disaster that we foresee coming, we need to make preparations for. Live in hope. You live in hope, but you prepare for the worst.
That's right.
So let's do it that way. And my better half is going to be on the scene, and we're going to give you, and we're going to bring people through this pandemic to give you the information, and so that you can understand what's going through, and not, just sitting in the house and being depressed, waiting for you to go back outside and
not let your guards down so fast, because I know that it seemed like it's so pretty outside, and you just want to get out there and you want to go visit your people. I went to visit my friend Cheryl Jones, Queen of Hearts, and I just wanted to give her some love and hug on her, but I had to catch myself, and I was like, no, there's still a pandemic out here, so keep your distance. So I was like, okay, I just have to love you for and say, hey, and I love you and things like that. But we just have to keep awareness in our mind that, hey, it's still serious out here, people. Don't let your guards down, because this is real stuff. And it's taking people out. It's taking people out left and right every second, every minute.
It's depressing when you can't touch somebody.
And when they have to be there alone.
But you can. It's not always physical touch.
Yeah.
You can touch somebody and be 6 feet from them. Mm-hmm. But always remember that. I know it's depressing. You can't go out and hug your grandmother and you got to stay 6 feet, but you can always touch somebody. You can write a letter and touch somebody.
Yeah.
Right.
So thank you guys for watching us, and y'all be safe out there. And thank you, Mr. Thompson, once again. And as that information was so helpful to us, and I hope it was helpful to everybody else. So until next time, we're going to say good night.